I don't know if you guys have been on social media lately, but man, there has been this plastic surgery procedure that is popping up all over social media, all over like the news articles. And I've been meaning to do it for a couple weeks, and we just had a lot of things we had to get to, and that is buccal fat removal.
Yeah.
Have you guys heard about this?
Not really, but I know it's like really, really trendy to do the face contouring. Remember those makeup hacks I did one time?
Yes.
And it's supposed to make that look like that, but this is actually to make it
this is like a permanent thing, And so, you get online and you pull up these articles, and like it's immediately like controversial. Like you have people saying, "Oh, it gives you this chiseled like cheek look that slims your face," and you got other people saying it makes you look like a zombie. And so this is a good one to talk about because it's like hot. Like I can't even open
Two
like
very extremes.
It is, dude. It's a controversial thing. So this is perfect for us to talk about.
Yes.
So it gained a little bit of popularity because there was a celebrity that just flat out came out and said, "I had this done," and is very open about it, and that's Chrissy Teigen. So I got a couple pictures, Travis. All right, so there's Chrissy Teigen, obviously beautiful. So obviously on the left side, that's her pre. I pulled that from her Instagram and like 3 years ago. And then her post-procedure picture is the one on the right. And I got another view of it, Travis. Yeah. So, I mean, you can see it. I think it's pretty obvious, or it is to me, like her cheeks are,
here.
Yeah, they're really hollowed out underneath her cheekbones, which, I mean, it does give it definition. And so she's been really open about the procedure, and and of course it's, and if you go into like your Instagram feed, it's just like people fighting about it. You know how social media is, man.
Yeah.
It's crazy. And then there was another celebrity that's rumored to have it, and I think she has, and that's Leah Michelle. Toss her picture up there, Travis. So I took that picture.
I know who she is now,
You didn't know her? Yeah. So the picture on the left is I took from her Instagram like a few years back, and then there's the picture on the right. And I mean, it could be like weight fluctuations. I mean, if you were to lose a ton of weight, you could potentially get that look. But I mean, I do think that it's very possible that she had this procedure done based on that picture. So there's a couple of people that have been talked about. And you can simulate what you would look like with this procedure. It's all right, have you ever sucked on a straw really hard? Yeah, so I tried to do, so this is gonna be funny. So I tried to do.
That's how I put on my makeup.
Is it? Yeah, okay, right. So I tried to do a before and after of me, what I would look like. But of course it makes here it is. So it makes your lips look really funny. And so I actually photoshopped the like lips on the left onto the one.
Yeah, that looks.
I mean, it looked worse though when I had like the really like, swirled up lips. But you can see like it slims my face. All right, ignore the ridiculous lips on the right picture. But you can see my cheeks on the right picture are much thinner.
You remind me of Brendan Fraser. Is that his name?
Yeah.
From like The Mummy?
Right, yeah, like with the chiseled jaw. It does kind of so like, I mean, I don't know, like I don't hate it. No. I'm not sure I would go do that, but I mean, at least in that instance where I think to me that's a mild kind of effect.
Absolutely.
Compared to like those other girls. Like, I mean, I hate to like beat up people, but I mean, I just don't really personally like the look of those other Teigen and
I
Michelle
feel like it makes them look older.
Yeah, and so that's exactly right.
Because like whenever you're young, I feel like your cheeks are like full.
Right,
and like
totally.
Not like chubby, but just like
full, right?
Yeah.
And then as you age,
then that sinks in.
You're exactly right. We're going to talk about that.
Yeah.
So I did want to like just talk a little bit about the procedure, not say, oh, here's these people. Let's actually talk about it. So the first question is, what is buccal fat? All right. So there's a fat pad in between your cheekbone and your jaw, like from top to bottom, and in between the masseter muscle, which is inside here, and the buccinator muscle, which is on the inside. So there's a little piece of fat. Now I got a picture, Travis, you want to pull that up? Right there, yeah, buccal fat pad. So if you look on the left side of the picture, you got your parotid gland, then there's the masseter muscle, and then there's the buccal fat pad going left to right. And then you got your buccinator muscle, which is on it's the muscle that's right underneath the skin on the inside of your mouth. And you also see that there's this duct going from the gland. That's your salivary gland, the parotid gland, which is something that you don't want to bang up when you're doing the surgery.
No.
But what they do with this surgery is they make an incision, and the incision's actually on the inside of your mouth. There's nothing on the outside. And you have to go through that buccinator muscle. So you have to, you have these retractors in there, and you make an incision on the inside of the mouth. Then there'll be muscle, and you split the muscle, and you open that, and you can push like this, and that buccal fat pad literally will kind of bloop, come out through the hole. And then you grab it, and you take a little cautery, and you just kind of shave it off. And then you rinse it out, and you close the hole with suture, and that's it. I mean,
that's cool. So like celebrities can get just like in a snap. Nobody will ever know. Except, nobody would like know like.
Right, there's no incisions to see. Yeah, right.
Like, so, no,
and I was looking online, and there are people doing this under local anesthesia only. Now, I'm going to comment that I think that's a bad idea, and let me tell you why. I mean, one, if somebody starts bleeding on the inside of their mouth and they're awake, I mean, that can totally induce panic. Not for the doctor, but for the patient. So that's my first complaint about doing this under local, if you're going to think it. I just think that doing something where you're making incisions inside the mouth under local it's not dangerous, but it has the potential to be exciting in a bad way.
Yeah, that sounds like a bad dentist office visit.
Yeah, and then the second thing that I don't like, and I don't do this surgery, which it's a spoil the surprise, I was going to say at the end. But if I was going to do it, I wouldn't want to inject local into the cheek and then have to judge how much I'd taken out. Because I think if you're going to do really fine work, you don't want it to be distorted. Because when you inject local, everything swells instantly. Mm-hmm. And if you do that and then you are looking at the outside and judging how much you took off, I mean, you could get into trouble because what you're seeing is not reality.
Yeah.
It's been increased with your local anesthesia. So I don't really think that doing our local is really a great idea personally. Afterwards, the recovery is not too bad. You're going to swell, so you're going to have swollen cheeks for, probably weeks to a month or even longer. The face does not like to be messed with, and when you mess with it, it swells. It's like when I do facelifts, which I don't do tons of facelifts, but I occasionally do them. I tell people, look, you're going to be swollen for weeks. I mean, it's just part of the deal. Same thing with this. I do think it's important to talk about the risks of this surgery.
Okay.
So any surgery carries bleeding and infection. And so with this surgery, those are what we're talking about. As far as bleeding goes, the face has a really good blood supply, which does decrease infection, but it also increases the risk of bleeding post-op, so you got to be aware of that. As far as infection goes, the face has a good blood supply, so the infection rate goes down, but it's inside your mouth.
Yeah.
It's hard to sterilize that.
Yes.
So there is bacteria in there. The only patient I've ever taken care of that had a buccal fat removal was a patient that went to Mexico and had it done, which of course you know how I feel about that. And she got a terrible infection. She had the biggest abscess in her cheek, and I had to open it from the outside because it was just pouring pus. And of course she did get it done in Mexico, which is who knows how quality
not the best idea.
Yeah, it's really a bad idea, and we've talked about that. Mm-hmm. But so bleeding and infection, muscle paralysis is a thing because you're in there around the muscles that control your motor function of your mouth, and it is possible that you bang up a nerve in there that affects how your mouth works. So there's that kind of downside. Asymmetry, having one cheek look different than the other, or overdoing it and having a hollow, I think Chrissy Teigen and Leah Michelle have, is a real thing. But to me, I think the biggest risk is, and I made a picture and it's silly, it's like a meme. Throw it up there, the next one. Where's that, Travis? Yeah, why did I get buccal fat removal 20 years ago? You guys, all right, do you guys know who that is?
I forget his name, but yes, I know.
I know it's from Thor. No, Thor. Captain. Oh no, Thunder.
Oh no,
something.
He's got it. No.
Captain something.
So that's He-Man, or no, that's
He-Man.
Skeletor from He-Man. Yeah.
He-Man.
I was telling my wife, she's like, when I was making the pictures, I was like, look, I got a picture of Skeletor. She's like, they're not going to know who that is. I'm like, yeah, they are. They're going to know.
I know who it is.
So,
I just forgot his name.
Yeah, I forgot his name too.
My biggest concern with this procedure, and especially for people like Chrissy Teigen and Leah Michelle, you said it at the beginning of the segment. As we age, our cheeks hollow, and it makes you look old. That's one of the things that makes you look old. And if you start out looking like that in your 20s and then you age 20 years, you're gonna look like Skeletor. These are not surgeries that have been done for long periods of time. So you don't have that kind of 20, 30, 40 year, patient history to look back on.
Yeah.
I think those people are gonna really, they're gonna regret it to the point they're gonna have to have something done. So then they're gonna have to get fat grafting to fix it. So it's you get this procedure, and you age 20 years, and you have to get another procedure. I don't know. So, I mean, so I guess lastly, it'd be like, who is a legitimate candidate for this? I mean, I don't want to say this is a surgery that should never be done under any circumstances, because, I mean, there are people out there that genetically have these really, really full cheeks.
Yeah.
I mean, they exist, right? And it's kind of like if you could get a result like I had in my picture, where like, Travis is like, oh, you look like Brendan Fraser. Oh, damn, that's good, right? I mean, and it's not like overdone.
Yeah.
But I think that the patient that would, really consider this would be a young patient, because you don't want to do it if you're older, that has just genetically really full cheeks. But I think that you have to get it done subtly.
Yeah,
if you get it overdone, you're going to regret it.
I feel like that's with anything.
It is, but like, man, I think this is even more so.
And let me clarify.
What's on your face?
Let me clarify too. You still do favor Brendan Fraser, even with the face you have. But
thanks, man.
It looks like you look like him there too.
Oh, thank you, Charlie. Thank you. I always, who I always get. Have we ever talked about which celebrity I always get? Chandler from Friends. When I was like when I was live streaming, I think his name's Matt Perry.
Matt Perry.
Matthew Perry.
When I used to live stream on Insta and TikTok, which is how this show, originated, was me doing live streams. We had this bet, me and my social media person, Dory. It's like, how many minutes would go by, because on social media, when we go live, we would have hundreds or thousands of people watching. Yeah. It's like, how many minutes go by before someone says Matthew Perry? We would play that game every week. And it was every single week. But
that's funny.
I think my hair was taller then. I don't know. I changed my hairstyle. But
yeah.
All right, so going to the last thing I'm going to say is, like, do I do these procedures? I'm going to pass on these. I mean, they're not hard to do. I mean, they're really not. Like,
from all the surgeries that you've explained, I think this one's
this one's pretty simple. I mean, there's definitely some artistry in it. The reason I don't like it is, one, I think a lot of patients would come in that I would just say, I'm not going to do it on you because I think it's going to be bad down the road. And then that's just wasting their time. And then for the patients that came in that I thought really needed it, I would want to do something conservative. And I'd be afraid that I'd do the surgery and they'd be like, okay, well, it's not enough. And I'd be like, well, I don't want to do it so much that you're going to hate me in 10 years, And so to me, there's just too many potential, like, not like, life-threatening problems, but problems that I don't want to deal with. Yeah.